Hey guys, Dr. Luster here, and I wanted to take a second actually from my last video because I was just talking about the differences between the medical community and the holistic community and whatnot, and I was finishing it with talking about physical therapy. And I wanted to actually clarify a little bit on physical therapy versus applied kinesiology because it gets a little confusing. So physical therapy has this mindset of the muscle is weak and it is atrophied, which means that it's kind of wasting. It's not as big as the other muscle, as the other side. And it's weak because it needs to be strengthened because it's been relaxing too much, right? So the way that they go about and fix that is they have you, let's talk about your biceps because that's just an easy one. So if your biceps is weak, then it must be weak because on the muscle test that they're giving you, it must be weak because it's been chilling and you haven't been doing enough arm lifts, or biceps curls or whatever. So to strengthen that, we're going to make sure you're doing them appropriately and the appropriate exercise to strengthen that muscle, right? So lots of biceps curls, and that should strengthen that muscle, and it's going to be painful, and we're going to work through that, and there's some fascial stuff that's going on, some tendon stuff, all of that. We can definitely work through all of that, but that's the idea, is that let's strengthen that muscle because it's not working, because it's been lax for too long. So applied kinesiology has a very different mindset. Now, let me put in the caveat, physical therapy works, and the reason why it works I will explain at the end. But I personally believe that they're going about it a slightly different way, and I believe that it works better when it's in conjunction with chiropractic, and I'll also explain. So applied kinesiology is of the mindset that your muscle has one job, and that is to contract. When it's not contracting, when it's like, so it's like a light switch, right? Your light switch has one job, to turn the lights on, and then when it's time to turn it off, it doesn't have to work, right? Turn it on, work, turn it off, not work. Same thing with your muscle. So contract, work, don't contract, rest. So if the muscle is still able to do its job, right, and it's still able to contract, then there are other factors at play here. It is not that the muscle is weak, because there's not really a weak muscle to be had. It is, muscles don't have varieties of things, just like a light switch doesn't have a variety of things. It is on or off. So that is applied kinesiology. Now, let's take this a little bit further to the biceps, right? So if your brain has multiple pathways for everything, let's say it that way. So let's say that I injure my elbow and I no longer can contract this muscle, right? And it hurts to contract it or whatever, but over time, as it starts, healing a little bit, I can contract it more and more and more, and I can move my arm relatively the same, but it's weaker. I can't hold it the same way, right? So that's where PT would come in and say, we need to reiterate this more and strengthen it. AK is going to say something different. AK is going to say, well, when you injured that, you actually shut off some of the brain connection to that biceps. So now your brain, when it's trying to talk to the biceps and say, hey, contract your arm, hey, please contract, biceps, hello, it doesn't get conversation because something's blocking it. There's something neurologically blocking it. So instead, your brain goes alternative routes. So there are actually multiple muscles that can move your arm in this position. Now, that is their secondary job. It is not their first job, not their primary job to move it. That's the biceps job. But they have secondary jobs that they also contribute to it. For example, your brachioradialis. So that is a great example of something that is pulling your biceps, pulling your radius to your biceps, and it does it as a secondary job. So if the communication highway is blocked, right? So you have a traffic highway on that, or a traffic blockage on that main highway, which is your biceps, right? Well, traffic is still going to find a way. Your brain is still going to talk to the biceps, or to that arm to move the arm, because it needs to move the arm, but it's just going to go an alternate route. So now it's taking the brachioradialis route and it's pulling it up, right? So this idea then is the next step then is that if we are continuing to reiterate that pathway through physical therapy, through continuing to contract that muscle in that position over and over again, then we are telling the brain this is actually the right pathway, this alternative pathway, and we need to go down this route. Now, unfortunately, your brachioradialis is a secondary it's its secondary muscle, so it was never supposed to be the primary mover of that, so it's just not as strong. It is not going to be your biceps. So unfortunately, you can keep working at that, but you're not going to get there or we're probably not going to get there because it's not designed for that. Now you've reiterated that this is the primary pathway. So let's say for whatever reason that then your elbow popped back into place or something, because that was just as simple as it was for simplicity's sake. And now your biceps is back online, but now your brain's like, no. We've learned that this is the path. This is the better path through this other route. And so it only takes that route. So even if your biceps is online, it's still going to be weak. Does that make sense? So AK goes the route, no, let's go turn the biceps back on. Let's find out what's turning the biceps off. And then we will restore the strength that was supposed to be there. And it's really, really cool because you will see through some of the muscle testing that we will do that you really can affect change and the strength of a muscle by doing just an adjustment, a neurological adjustment that was blocking something. It is really, really cool. So my argument with physical therapy is that it absolutely works once things are turned back on and talking to each other the way they should be. Once the highway is clear and we're not using side routes for things. Then yes, let's work on physical therapy. Let's work on movement. Let's work on getting some of these things moving the way that they should. And that also brings me into my last little statement with that is that the some of the other techniques where they are they call it the Graston technique, I believe, or a scraping technique where they're really scraping some of those muscles. It beats it up a little bit. It's like punishing a muscle for doing its job because it's not contracting appropriately enough. So like a lot of those things they'll do because the muscle's too tight, right? So we need to scrape it. We need to get it to chill out. Let's scrape it, and get all the knots out. Well, yes, there are muscle knots and stuff that are going on, and yes, it's inappropriately contracting. But why isn't it inappropriately contracting? Why is it stuck in the on mode? So that's telling you that if, like, let's say, take the arm again, for example, when it is time for the biceps to rest, then its opposite, which is the triceps, is contracting. So to pull your arm down, you have your triceps contract. To pull it up, you have your biceps contract. They alternate like a seesaw. So if that's the case, then one is stuck in contraction because the other one is not contracting. Why is the other one not contracting? And does that release the one that's stuck in contraction? So kind of beating up the muscle when maybe it doesn't need that. So maybe it needs to chill a little bit. So I would argue that chiropractic is really super helpful, specifically AK, because it kind of searches this, but it's super helpful into asking these questions. And then in conjunction with PT, what a powerful tool, what a powerful tool to really gain strength and gains in that type of situation. So I hope that clarifies it for you guys. I know it's a little bit confusing, and I'm not trying to bash PT because I really think PT can be amazing. I just wish that they would incorporate chiropractic and specifically AK with some of that. But again, they succeed, and it's that whole yes, we can do an alternate route, but is it always going to be the same, that kind of thing. So I hope that helps. And if you have any questions, definitely reach out. And I can't wait to see you guys. Thanks.